Welcome to The Explainer. Today, we're zooming in on one of the most intense life-or-death scenarios the human body can literally ever face, a myocardial infarction. Let's just be absolutely clear right out of the gate, this is a biological ticking clock. But hey, do not panic. Understanding exactly how this clock works, how to spot it, and crucially, how to stop it, well, that could literally save your life, or the life of someone you love. Okay, let's dive into this. Here's our quick roadmap for today. We'll start with the anatomy of a heart attack, then move into spotting the warning signs, lay out the emergency action plan, look at hospital diagnosis and treatment, and finally wrap up with recovery and prevention. All right, let's lay down the foundational definition. A myocardial infarction, or MI for short, is the clinical term for what we all know as a heart attack. It's a severe medical emergency where blood flow to a specific part of your heart muscle is just suddenly completely blocked. And the terrifying reality we really need to grasp here is that without that continuous supply of oxygen-rich blood, the heart muscle cells literally begin to die within just a matter of minutes. So, let's get right into section 1, the anatomy of a heart attack. Think of your heart as this incredibly powerful, relentless muscular pump. It relies entirely on its own dedicated network of coronary arteries for fuel. And the timeline of a heart attack inside these arteries, it is devastatingly fast. It kicks off when a silent fatty deposit called a plaque, which has just been slowly, quietly building up, suddenly ruptures. Instantly, your body's immune system freaks out and forms a blood clot to heal that rupture. But the clot forms too well. It rapidly and completely blocks the artery. Boom, blood flow stops entirely. And that's exactly when the ticking clock begins, because that starved heart muscle is starting to die. Now, what's really interesting about this slide is looking at why those dangerous plaques build up in the first place. The primary culprit is coronary artery disease, which is driven by atherosclerosis. But take a look at these risk factors: high blood pressure, diabetes, high cholesterol, smoking, obesity, and chronic stress. Notice a pattern here? These are compounding factors, silently stacking up over a lifetime. But the really crucial takeaway? Almost all of them are highly manageable with everyday lifestyle choices. Moving on to section 2, spotting the warning signs. Because recognizing these signals, that's your absolute best chance to stop the clock. And this brilliantly illustrates the vast contrast and how these signs actually present in the real world. On the left, you've got your classic Hollywood heart attack. Crushing chest pressure, that distinct feeling of an anvil sitting on your chest, and pain radiating down the left arm or up into the jaw. But then look on the right at how symptoms so often present in women. We're talking profound fatigue, unexpected nausea, back pain, or even just feelings that mimic severe indigestion. These nuanced symptoms are so easy to dismiss as just a lingering stomach bug. But trust me, they are every bit as deadly. We also really have to look closely at specific populations here. For elderly folks and diabetic patients, the presentation can be even trickier. They often experience just mild chest pain, some unexplained shortness of breath, or, and this is wild, silent heart attacks. Yes, literally silent. That means the heart muscle is actively starving and dying with minimal or absolutely no obvious outward symptoms whatsoever. It's a grave, vital fact to keep in your back pocket, especially for your older loved ones. Which brings us to section 3, the emergency action plan. The stakes are sky high here, guys. Whether the symptoms are a crushing weight on the chest or sudden severe nausea, the stakes literally could not be higher. Step number 1 on your emergency action plan. If symptoms last for more than just a few minutes, or if they go away and keep coming back, your absolute non-negotiable priority is to call emergency services immediately. Period. Do not wait. Do not try to just sleep it off. Call 911 or your local emergency number right that second. While you're waiting for those paramedics to arrive, here is your rapid-fire survival checklist. Stop all physical activity immediately. Sit down or lie down in a comfortable position. You have to force yourself to stay calm. It actually reduces the heart's workload. Loosen up any tight clothing. If a doctor has previously recommended it and there are no medical reasons not to, take an aspirin. And obviously, if the person loses consciousness and you're trained, begin CPR immediately. You really must act fast here, because in the medical world, time is muscle. Delaying treatment doesn't just mean a longer recovery, it actively leads to catastrophic complications. We're talking severe long-term heart failure, dangerous electrical arrhythmias, cardiogenic shock where the biological pump just completely fails, or sudden death. Failing to act on that survival checklist we just went over, it rapidly guarantees these devastating outcomes. All right, Section 4, Hospital Diagnosis and Treatment. Let's look at the race for medical intervention. So let's assume you made the call and the ambulance has arrived. This is where the medical team kicks off their high-speed race for intervention. Doctors will immediately categorize the severity of the situation. A STEMI is the most severe form. That involves a complete artery blockage that shows up loud and clear on heart monitors. An NSTEMI involves a partial blockage, which is less severe but still incredibly dangerous. And then again, there's the silent category, which varies in blockage severity but is defined by those entirely missing symptoms, making it a really tricky puzzle that's particularly common in diabetic and elderly patients. To figure out exactly what they're dealing with, the medical team deploys an absolute arsenal of rapid diagnostic tools. They'll grab a quick medical history, sure, but they rely heavily on an electrocardiogram, or ECG, to instantly detect any abnormal electrical changes in the heart muscle. They're also going to run rapid blood tests looking for specific distress markers, like troponin and CKMB. You can basically think of these markers as internal alarm bells that physically spill out into the bloodstream the second heart muscle cells start dying. Once they've got the diagnosis, the entire goal is reperfusion therapy, which is just a fancy way of saying physically restoring the blood flow. Primary PCI, or angioplasty, is where doctors thread this long, tiny catheter all the way up to the blocked artery, inflate a microscopic balloon to literally smash the blockage against the artery walls, and then leave a wire mesh stent behind to hold the whole thing wide open. If the damage is too complex for a stent, they might pivot to CABG, or bypass surgery. That's where a surgeon physically creates a brand new circulatory pathway right around the blocked arteries. Now, another vital tool they use in the emergency room is thrombolytic therapy. This involves highly specialized, rapid-response clot-busting medications. So instead of using physical tools, these powerful drugs are injected to chemically dissolve the arterial blockage from the inside out. It quickly restores the blood flow and stops our ticking clock dead in its tracks. Finally, we arrive at Section 5, Recovery and Prevention. The acute crisis is over, so let's talk about the path forward. Once that blockage is cleared and the patient is fully stabilized, we can transition our focus entirely into hope and survivorship. So the crucial point is that recovery is absolutely not a passive process. Cardiac rehabilitation is an active, heavily supervised regimen. We're talking specialized, safe exercise programs designed to physically improve cardiovascular fitness, right alongside comprehensive education, nutritional counseling, and stress management. You really have to actively train your heart to heal itself. And beyond the structured rehab, survivorship requires wearing a sort of everyday armor. These lifestyle changes, maintaining a healthy diet, strict weight management, getting regular exercise, keeping your blood pressure and diabetes perfectly under control, and rigorous daily medication adherence, these aren't just suggestions. These are your active daily shields to prevent a secondary attack. And, the incredibly encouraging news to take away from all this data is that early treatment significantly improves survival. I mean, it's a real game changer. If you respect the ticking clock, react quickly, follow the medical advice, and embrace these necessary lifestyle changes, the transition from a victim into a survivor is profoundly successful. Many patients return to long, completely normal, and highly productive lives. Let's actually look at this powerful quote directly from our source material. A healthy lifestyle remains the best defense against heart disease. It's a deceptively simple sentence, right? But it actually carries the entire weight of modern medical consensus. At the end of the day, prevention is ultimately the most powerful medicine we have. Which leaves us with one final, deeply personal question to close out this explainer. Look at the risk factors. Look at the anatomy. What is one heart-healthy habit you can start today to protect your ticking clock? Think about it. Thank you so much for learning with me today, and hey, stay healthy out there.